Before I go on discussing um, the different pathologies that relate to cardiovascular imaging, first I would like to present to you several normal chest x-rays. This is to help your mind and your eyes visualize what is normal, because only by knowing the normal can we know what is abnormal. So you really have to master, or you have to practice and train your brain to see what is normal. So by looking at normal radiographs, you'll be able to identify if something is wrong and should not be there in the first place. So this is our first chest radiograph. So this is on PA view. All of these radiographs are on PA view, which is the standard radiographic view that we take. All these cases are for annual physical examination, so we expect them to be normal most of the time. And the age group is at around 20 to 30 or 35 years of age. So we don't expect to see degenerative changes um, in the chest. So this is our first normal radiograph. Um, you look at the lungs, it's clear. Then all those densities that you see in both lungs are just vascular markings. So we know that they are vascular markings is because they arise from the hilar region, both sides, and they branch out peripherally, tapering towards the distal, distal aspect of the lung parenchyma. So they taper down as they go outside. And in the outer third of each lung, there's almost very minimal vascular markings that we see. So that is expected and that is normal. So our heart contour or cardiac contour is also normal. So we measure the cardiothoracic ratio, which is the AP, the width of the heart over the width of the ends of the CP angle. So the value should be zero point 0.5 or less. So this is another normal radiograph. So in this radiograph, what we can see also is companion shadows. So look at this, just above the left ventricle, you have a line that goes parallel with the contour of your left ventricle. So this is what we call companion shadows. So they are normal structures that we see on radiograph. Again, you look at the images and it's clear now. Again, those vascular markings tapered off as they go towards the periphery. We can also again see the companion shadow I was talking about earlier. So these are the expected findings of your lungs. You have sharp CP angles. The diaphragm contour is dome-like, dome in shape. And you see the gastric bubble on the left side of the upper abdomen. Here is another normal radiograph, slightly taken oblique. We know that it's a little bit oblique because of the distance of the medial ends of the clavicles. So the right medial end is more farther away from the spinous process, while the left medial end is much closer to the spinous process. But still, this is a normal radiograph. So again, the pulmonary vessels are tapering as it goes towards the periphery of the lung. So if you've noticed, you might also see some nodular densities near the hilar region. So these are just, again, pulmonary vessels, which we are seeing en face, meaning they are looking towards us. So, for example, if this is your vessel, you're looking at it from this view, not this way. So if it's this way, that's why we see them as branching lines. But since they are pointed towards the image, that's why we see them as nodules. But we know that it's vessels because they are also continuous with those lines. that we see. Again, a normal radiograph. I hope you get to see a pattern when you look at these radiographs. So again, the hilar vessels are quite prominent, the main pulmonary arteries, but they will always taper when they go outwards. Mm. Also try to look at the shape of the heart. More or less, this is consistent with a normal heart, with no obvious signs of chamber enlargement, which we will tackle later on. We also look at the bone structures. Again, we make sure that more or less it's equidistant. This is another radiograph that's slightly oblique. We see a wider space, medial end of the right clavicle. The distance, its distance towards the spinous process is again much greater than compared to the left side. But still, this is a normal radiograph. So this is another normal radiograph. If you recall, you can also check if you have to check also if the lungs are adequately, there's adequate inspiration. So to check, you must be able to see 10 ribs, 10 posterior ribs, ideally. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this is an adequate radiograph. So we want to make sure that it's adequate so that the structures will not be enlarged, especially when the film is taken in suboptimal inspiration. You'll see crowding of these lung markings, and they will appear prominent and engorged, and we might be mistaking it for congestion. So this is another normal radiograph. So this is typical appearance of thin patients. So the cardiac silhouette is almost vertical. So the bulging border forming chambers are not prominently bulging as compared to the previous radiograph. So it's almost, this is what we call an almost vertical heart. So if it's really vertical and the diaphragmatic dome is lost, here it is, we can still appreciate the dome. But for those cases wherein the dome is also, the outline of the diaphragm is also lost, then we can say that it could be due to pulmonary hypertension or emphysematous changes. Next, here's another normal radiograph. This one is not so well inspirated, but we can still see 9 ribs from top to bottom and still clear. Here is another one. So this one has a really nice outline of the pulmonary arteries, and it's really well differentiated from the cardiac borders. Here's another normal radiograph. This one is taken at a slightly apical lordotic projection. I'm not sure if you've noticed, but um, the upper ribs are more or less superimposed to each other, and we can see, and there's we can see clearly the lung apices. So this one is PA view, but it was taken at an slight angulation, and still normal. And here's another normal radiograph, and another one. Um, you also look at the outline of the aorta. So in most normal patients, the aortic knob is not very prominent. So it's just this small bulge pointing towards the left side. And the descending aorta is superimposed against the spine, so you won't really clearly be able to delineate it. Another normal radiograph. Again, we have clear lungs, the heart is not enlarged, the aortic contour is not dilated, the diaphragmatic dome is again preserved, and you have sharp costophrenic sulcites. Mhm. There's companion shadows on both ribs. So that's it. I hope you're able to train your eyes on what is a normal appearing radiograph.